Welcome to October's Chief Exec Shoutout. We've got a great programme today. We're meeting the leaders from Tavy ward and Amanda Clements, who's been doing some fantastic work in liver services in our community. But October is a really busy month, and many of you will know operationally how busy it's been. So can I just say thank you so much for everything you and your colleagues are doing every day. I really do appreciate it, and I'm delighted that we continue to get really good patient feedback, recognising how challenged we are. And there's lots of work going on to just try and get ourselves really ready for winter, although it feels as if it's here already. October is also a really important month because it is Freedom to Speak Up month. And you will know through the different daily emails and some of the other all-staff briefings we've been doing how important it is to use our many channels to speak up. We know that culture is absolutely fundamental to good patient safety, and I know that it can feel hard at times to speak up, but I'd really encourage you to do so if you feel that you are not being treated well, or you are not seeing others being treated in a way that you would want for yourself and your colleagues. We do take issues of poor interaction, incivility, and anything that is discriminatory extremely seriously. And we will be doing a special edition of Chief Exec Shoutout just on all of the cultural work that we're doing. And I'm also pleased to say, and a bit of a shout out here for Hospital Radio, who are now been providing fantastic service, but they now will be able to reach more homes as they've been part of a bigger forum in which and joined others, so their publications and their programs can go out to a much wider group. So I'm doing a bit of a desert island discs, I think, towards the end of the month. I hope you have time to just listen in on that and realise what terrible music taste I've got. But just to say thank you, I hope you enjoy this month's shout out and look forward to meeting you all. So today I'm on Tavy ward, which is one of our 2 medical assessment units and probably one of the busiest places in the hospital, just as our patients are coming through their care journey. Now, the reason I'm with Tavy today is that they have been nominated, I'm delighted to say, for one of our VIP awards. So VIP is Values in Practice, and what we're asking teams to do, and individuals, is to nominate somebody or a ward or a team where they feel they have gone above and beyond. And that's absolutely what this nomination has said about this team on Tavy, that not only do they go above and beyond, but they always do everything that's about compassionate care and really supporting patients on the next step of their care journey. And we can't really ask for anything more than that. So I'm really delighted to be joined by Vicky, Rachel, and Laura, who are part of the team. So Vicky, you're the ward manager for Tavy. So just tell me, how does it feel to be nominated to be VIPs?
We're all absolutely ecstatic to have this nomination. So whoever put the nomination in, I just want to thank them so much. It's nice to see that we've been recognised for the work that we've done as a team of sisters. I feel extremely lucky to have them by my side. And I appreciate everything they do in their daily work.
That's lovely. And one of the things I like about the VIP Awards and what came out from the nomination is, and we've got 3 of you here today, but it is really one big team, isn't it? So tell me, how do you really build that sense of team togetherness, team purpose for what, you know, is such a busy area?
I think we've remained visible to our team throughout whatever shift we're nurse in charge of, just making sure that they know that we're there for support and guidance should they need it.
I think clinical credibility comes down a lot. So these guys, including myself, have all been out there. We've done the work that they've done, and it's that real role model for them. And I think we gain their respect in that sense.
Yeah, and it sounds as if you all sort of, as well as doing your role, you all muck in as well. And I think being visible, walking alongside colleagues is really, really important, isn't it? And I know we've been trying to do, all the hospital is really busy at the moment, and we're trying very much to protect the values and compassionate care. And again, I know your team are absolutely recognised for your can-do attitude and that care and compassion. But across the trust, we've started to run the 11 o'clock morning meetings, which is done on Teams, and I join when I can, and I really enjoy them because I get to see everybody, but also I get to know about what's going on. So how's it felt from you, and what do you like about those meetings?
So I think it's a great example of collaborative working. We've all got one common goal which we're trying to achieve. We're looking at discharges, and it's a nice way for MAU actually, because after speaking to all the different ward managers and matrons, we can see the struggles perhaps they're going through, and then they can see what we're going through, and we can help each other sort of along the way. I can then come out and say to the girls, so-and-so ward has got a discharge, be prepared, let's get the patients ready. So it's really good prep for us, and again, it's nice to see a face to the name on the camera.
Yeah, that's what I like, because I think it's then sharing the different ward situations, isn't it, in a way that you couldn't really get 30 plus people together, and I think we get through it quite quickly, which is good.
Absolutely.
So I'm always conscious that you'll take patients mostly but not exclusively from the emergency department. You do their assessment, and then they often are going to other wards in the hospital. And just tell me how you support patients who might feel quite frightened, not very well obviously, but being moved on to another area. How do you do that with your patients? How do you help them with their care journey?
I think good communication with our parent patients. So when we know we've got a bed for them, we'll tell them, so we're open and honest.
Yeah, so they know it's coming.
Yeah, reassure them that they're going to the best ward for their care. So hopefully if it's cardiology, then they're going to cardiology. Just give them a little bit of reassurance.
I think part of our job role is being an advocate for the patient and working closely with site to try and get the patient to the right place. And reassuring the patient of that at the end when we've made that decision, because often it's not always possible, but when it is, making sure that the patient's going to the right place is paramount.
Yeah, I think that's really important. So I guess my last question to you, and I've been dying to ask you this, is I can often see how super busy everybody is, and then when I walk on your ward, you are really busy, but you're all really positive. In fact, I've just walked through now and everyone's being like, oh hi, how are you? So they've always got time. How do you keep it so positive when it must feel so hard?
As a team of sisters, we like to share a lot of praise we get with the team to keep that uplift. We always come out with a smile on our faces and say, come on, if someone has a problem, it is a shared problem. We've always maintained that. So we might do huddles in the morning, our safety briefs, check in with the girls quite a lot, welfare checks. The sisters have a management tree, so once a month they will check in with a staff member they've got. Are you okay? Any concerns you have, let us know, and then maybe the girls can come back to me and we can see if we can solve anything. So I think little things like that really do help, and making people feel welcome. We've got a lot of international staff coming at the moment. I know what it's like. I've got a multicultural family, so I know maybe the challenges that they might be facing. So to make them feel welcome, have my number, have the sisters' email addresses, straight away we'll put them with a buddy, really welcome them in, get to know them, what's their experiences, where can we put them in the skills, things like that. I know the girls do a lot, mainly they're out there with them, supporting them. I think it's just really important. If they've got good job satisfaction, they're going to give that high quality care at the end of the day. That's what we all feel.
We try and do things out of work as well, don't we? Like we had a day at Adrenaline about 3 or 4 weeks ago. Yeah, so good team building day. We've started up we did a netball league as well. So maybe if there's, it's a very female dominated ward. So sometimes, we're not always going to get on with each other, but when we noticed things weren't going so well, we thought, let's do the netball team.
we're all then on the same side against someone else external. So it's really helped bring the team together. And I think conflict as well, nipping that in the bud straight away. We've done quite a lot of work on that. Sorting it out straight away rather than let it fester.
And all of that sounds absolutely brilliant, and I can see absolutely why you're VIPs as a team, and just wanted to say huge thank you for everything you and your team do every day. And what's been really lovely is, you know, that support for your team, for each other, and actually just about getting patients cared for in a really compassionate way and getting them on to the next place where they can get better. That's lovely. Thank you so much and have a great day.
Thank you.
Thank you.
So my next guest at this month's Chief Exec Shout Out is Amanda Clements. Now, Amanda is a specialist nurse consultant for hepatology or liver services, and she's been doing a huge amount of work, not just within the hospital, but really importantly, how we support our patients outside in the community and with the different settings that we have, and getting really early access and diagnosis. I'm going to be talking to Amanda about the Community Liver Disease Pilot. So Amanda, welcome. Really nice to see you. So we're doing some work on the Community Liver Disease Pilot. Tell me a little bit about the pilot. What is it?
So NHS England are working very hard to promote early detection of cancer, and one of their top 5 cancers is liver cancer. And we have expressed our interest in supporting this programme, and we're one of the successful bids in this year to be commissioned, if you like, to be funded to undertake this pathway. And the whole purpose of it is to find people in the community with liver disease, and particularly those with cirrhosis, because we know that people with cirrhosis, they have an increased risk of developing a liver cancer. And what we want to be able to do is find those patients or people and get them into a surveillance programme for this earlier, so that if they did develop a liver cancer, there are more treatments available to them. Sadly, currently at the moment, it's quite a challenge to find people. When they do present to the hospital particularly, then they've already got quite advanced liver disease. And the focus of this arm of this pilot is trying to work with people who don't necessarily engage or find it easier to access health services for many reasons. And so we want to take that service to them, close to where they are, be that their GP surgery, community setting, or outside their doorstep. We have a scan in a van, so we're very mobile to do this and try. And I think the other aspect of this is raising awareness of liver disease.
So what are the sort of factors that would increase your risk of developing liver disease?
Well, in this pilot we have 4 criteria that we're looking at. And the first sort of area is around viral hepatitis, hepatitis C and B. Now there's already lots of amazing work going on around that. We have a big programme across the whole region for that. And then the other area is around people who may have what's called now steatotic liver disease, so fatty liver disease, and alcohol-related liver disease. And so, you know, because liver disease, you don't really have symptoms until it's very advanced. So we're very keen to find those people who probably don't even know that they have cirrhosis at the moment.
So just in terms of the diagnostic, it's a FibroScan. Yeah. So what is that? What happens to you if you were a person going in to have a scan?
Well, it's an amazing piece of kit, and it fits into a little suitcase that you could smuggle on board an aeroplane if you so wished. So it's very portable, and I've watched the evolution of this equipment over the decades. All you have to do is lie down on a couch, be willing to let us get to your ribs, and we place a small probe on the side of your ribs, which is an ultrasound in the tip. And that shows me when I'm over the liver, and it generates a little pulse of energy, and it calculates the speed by which that travels through your liver The stiffer your liver, the faster that travels. So it gives me an instant reading, an instant number, and I can give that to the patient. And it's an excellent opportunity as well, to make every contact count. So even if their score is normal or in a healthy range, we can still offer liver health advice.
So that should be really encouraging, isn't it? Because it's not really an intrusive thing to have done, as long as you're just happy to pull your top up a bit, the cold jelly. So when you do come across a person who's got a raised level that you're concerned about, what happens then? What's the support that individual gets?
Well, obviously a lot of people, it would be quite, for some people, quite scary to have be told that your reading is higher than we would like, suggestive potentially of advanced scarring or cirrhosis in your liver. What I will offer them then is the opportunity for me to investigate them further, and we will take some blood tests and we will probably do some imaging of their liver, such as an ultrasound, and try and confirm the readings from their FibroScan. And if we do find that they have cirrhosis, we confirm that with our other tests, then we will ensure they are entered into a surveillance pathway. One of the amazing things from this project, and some of the learning we've had from our hepatitis C operational delivery network, is the use of peers. And so we are funded to look at having a liver peer, as we have with Hep C peers. And these are people who may have had lived experience themselves of liver disease, but they will support people who find it hard to come up to the hospital for an ultrasound, for instance, or blood tests every 6 months. And I think that's a really innovative tool, and I can reassure them that they won't be alone in that pathway.
That sounds really important, and certainly from what you've described, getting to people who wouldn't perhaps always engage with services, and in fact the condition itself perhaps doesn't show signs until it's quite advanced. This is a community programme, so how important is it that these services are provided outside of the Derriford Hospital footprint?
I think this is one of the learning that I have had over the time I've spent in hepatology, is services probably work best for some people much closer to their home for all sorts of reasons. Whilst I have the luxury of living very close to Derriford, I was doing a session recently over in Liskeard, or even somewhere like Ivy Bridge, or if you don't have the bus fare, just living in St Budo or in Stoke is challenging for people. So the easier access makes I think services much more available for people, and it also I think shows that we want to care for people in their place of residence or work, wherever that is, and break down the barriers that we've talked about for years and years, of breaking down barriers between, big hospitals and actually the people who use those services. And so taking the hospital to them, I think, has got to be the way forward.
And I really love the way you describe it as a scan in a van. I think that's fabulous, because it's very much out and about, isn't it, which is really, really important. Now, it may be too early at the moment at the stage of the pilot, but have we got any sense of what the impact is going to be and how many more people we might detect through earlier intervention than we might do otherwise?
We are tasked actually, as part of the agreement with NHS England, to deliver a set number of FibroScans every month. There are targets. I'm very pleased to say that we're above target so far, which is very encouraging. Where it's very interesting, the results that we're seeing, and I think this is where we have to work at being very targeted and looking at where we go to find people and engage with them. So us engaging with them, perhaps not the other way around. We've done a lot of opportunistic FibroScan, if you like, sessions, and some of the benefits for that is health promotion and raising awareness of liver disease. But for those groups of people that we know have higher risk factors, we have picked up people with cirrhosis that didn't know they had it, and they've now been entered into a surveillance pathway. And for those people that really struggle, we're able to give extra support to try and get them, because unfortunately at the moment we still have to offer ultrasound at the hospital, but we are working on that and looking at new centres that are coming up in the community and how we can work with them.
So Amanda, thank you so much. It sounds a fantastic programme, and everything, isn't it, is about early intervention so we can get people the right care at the right time. Is there anything else you'd like to tell us about the programme? You've covered such a lot.
Well, I just think I'd really like to raise awareness about liver disease, but also to try and break down the stigma around it too, and that people can, there's still a lot of stigma and association, and I'd just like to welcome everybody to our pilot and reassure them that we really do want to find you and look after you and put you into the right services.
That's brilliant. Thank you so much.